Hello, hello. Hello, everyone. Happy Monday. It's Milky Mama Monday here in the group, and that means we cover all things lactation. Just getting things pulled up here, getting my notes ready so I can just dive in here. All right. Make sure I can see comments. All right. If you are joining me live, say hello down below, #live. Let me know where you're tuning in from. And if you have any questions over today's topic, I will be monitoring the comments as I am giving this training, so I can be sure to answer any questions that pop up. Feel free to drop those below. And for those of you who cannot make it live but are catching the replay, let me know with the #replay. And if you do have any questions as well as you are watching the recording, please drop those below, and I, of course, will circle back around and answer those as well. All right, just a brief introduction here. We do have several new mamas to the group, so I just want to give you all a very warm welcome. Introduce myself. My name is Jessie Sletton, and I am a postpartum empowerment coach and the owner and facilitator of this awesome group here on Facebook. And as a postpartum empowerment coach, I help moms exchange surviving for thriving through holistic postpartum recovery plans focused on healing, nourishing, and bonding. And as a certified lactation counselor, every Monday I provide an opportunity to discuss evidence-based lactation information and support and education so that you all have a source you can trust. There is a lot of misinformation when it comes to the lactation process and breastfeeding in general, especially in this day and age with a lot of Facebook groups, mommy Facebook groups out there that might have really great intention as far as trying to provide support for all of us who are going through this journey. But unfortunately, a lot of the information that is provided in those groups can be quite harmful and inaccurate. So this is why it is so important to me that I provide a space that is safe here for you all to get information you can trust based on the latest evidence and recommendations. So, without further ado, let's dive into today's topic. And I'm really excited about this one because this topic I'm pretty passionate about, and it is something that is very prevalent in these mommy support groups and these breastfeeding groups that I am a part of and that I help try to add support and value in. That I'm also a breastfeeding mother, so I am a part of that for personal reasons as well. But I see this all the time, and it's the encouragement of something that these women or support people are calling pace feeding. Okay, the way in which they are using this is not accurate, okay? And it is actually has, the potential of being quite harmful. So we're going to dive in and we're going to what I call myth bust this particular method of bottle feeding, okay? And I'm going to give you just kind of a brief overview of what true pace feeding is as far as the medical protocol and how it was originally intended to be used. And then we're going to talk about how that initial protocol and purpose has been kind of, I don't want to say... I honestly want to say bastardized, to be honest, you guys. I'm pretty honest here, but that it's kind of true. Okay, so it's really been kind of stolen from its original purpose and used in ways that are not conducive for really allowing you to be infant-led when it comes to feeding your babies and setting them up for a successful feeding journey, not just in their infancy, but it can have impacts all the way until they're older. And so we're going to talk about some of those things. And then, of course, I want to leave you with what can you do instead, okay? So that you don't feel like, oh my gosh, so then how do I feed my baby with a bottle if I am also a breastfeeding mother? Or if you're not a breastfeeding mother, this can also be very useful information if you are formula feeding as well from a bottle. This is basically infant feeding from a bottle and how we can do that in the most appropriate way to encourage a healthy feeding journey for your little one. Okay, so I don't believe I have anybody live on here. If you do, don't be afraid to say hello and ask your questions. Like I said at the beginning, I will be sure to loop around and answer those. All right, so let's tackle what we're talking about here tonight with pace feeding, okay? So first and foremost, let's talk about the true clinical use of actual pace feeding. Okay, so this is a protocol that is used in NICUs, all right? And this is for premature infants or infants that might be ill in like the PICU area as well. So it is for infants that are not full-term healthy babies that don't have any medical conditions that would prevent them from being able to basically, that is impeding them to have their feeding be successful in any way. Okay, so it's used in the NICU, like I said, for premature infants, and it's really to help them learn to transition from tube feeding to oral feedings. Okay, and also for those that are premature babies that really need to establish a suck, swallow, breathe pattern. Okay, so it's also used for older infants, not just for newborns, for those that have medical conditions that do impede their ability to feed. Okay, and it's always under the direction of their medical provider. So that is what the true protocol for pace feeding is for, all right? What pace feeding is not, and is unfortunately being promoted in a lot of these support groups that I am seeing, is basically, it's put under the guise of mimicking the way that a baby feeds from the breast, okay? So that's what its intention is trying to provide there. But unfortunately, what it's actually doing is causing restriction for babies' feeds, okay? So paced bottle feeding that's being popularized now is really keeping a bottle parallel to the floor so that the nipple isn't completely full of milk, so parallel to the floor, and using the very slowest nipple. I am seeing people recommend preemie nipples for perfectly healthy full-term babies, no matter what, and never to change the nipple size, and saying that it's unnecessary to size up as the baby gets older. Okay. This is not necessary, and in fact, it can really be quite harmful and frustrating for your baby if this is something that they have to work so hard to get milk from. They're going to tire very easily, and they may end up falling asleep because they have just tried to work so hard to get milk from the bottle. Okay, so that's one of the reasons why it is not recommended. This is not an evidence-based practice on how to feed your baby. Okay, I'm kind of going line by line through a very popular image here on paced bottle feeding that I'm actually going to drop in the comments so that you guys can see. But I'm basically going line by line and trying to tackle these misnomers or these myths and talk about why, okay? So the other idea from paced feeding that is fairly popular that we are seeing is that they are saying that you should feed your baby no more than 3 to 4 ounces, and it should take them 10 to 20 minutes to finish. Okay, and that is just not true for every baby. Okay, so some babies are going to pound down way more than 3 to 4 ounces, okay, in a feed because that's what they need. All right, so you need to be following your infant's cues, not restricting based on some arbitrary number. Okay, another popular thing that they say is that babies only need 1 to 1.5 ounces of milk per hour, no matter their age, and no need to increase as baby gets older. This is also false. Okay, that is way restrictive. And that may be true for some babies. If you are following their cues, great. They might not need more than that. But some infants need way more than that, and you should not be having it be parent directed or led. It should always be infant led, okay? So what I want you to think about instead, and what the AAP recommends when it comes to feeding your baby, is to practice responsive feeding, not paced feeding, but responsive feeding. And this is from infancy all the way up to, when your child is eating solids. You should be responding to your baby's feeding cues, and they will let you know when they are full. Okay? If your baby turns away from the bottle and does not want to latch again, they are signaling that they are full. Okay? The opposite end of things that you don't want to do, which is another reason why I think this has come into such popularity, is they want to avoid overfeeding a baby from the bottle. Okay? This, you can't technically overfeed a baby from a bottle if you are following their cues, okay? However, you don't ever want to force your baby to finish a bottle, okay? I do see some of this sometimes as well, especially in kind of exclusively pumping groups and things like that, where moms are just, wanting to make sure the baby finishes every drop of their liquid gold, right? That's kind of something that I see similar, or kind of a lot in these types of groups. That is also not practicing responsive feeding, okay? So if your baby is showing fullness signs and cues, you do not want to continue trying to force the bottle. The same can be said about the breast, okay? Babies are really, really good at self-regulating, whether it's bottle feeding or breastfeeding. If they're turning away from the breast, or getting fussy at the breast, seeming like they're done, or if they're older and they're starting to show biting behaviors, these kind of things, they're probably done with the feed, okay? You don't need to sit there and cause stress to yourself or to your baby trying to force the latch, okay? There might be other things going on. If you know that they are still showing some hunger cues and they're not wanting to latch, we can work through that separately. But long story short, we don't want to overcorrect either and try to force feeding the bottle and finishing the bottle, okay? So I just wanted to kind of tackle some of those myths when it comes to the paced feeding recommendations that I'm seeing in a lot of these groups. And like I mentioned, what you want to do instead is really practice the responsive feeding, okay? The AAP recommends that you actually tip your bottle up enough where the entire nipple is going to be full of milk, okay? This reduces the amount of air that your baby can take in while they're feeding. And that's going to really help improve, gassiness in your baby, and decreasing discomfort after feeds, okay? If you keep that bottle parallel, you're going to have a ton of air in the nipple area, in that, in the teat there, and it's going to get sucked in as the baby is drinking. And that's just going to fill their little tummies with lots of air, okay? So that's another reason why paced bottle feeding can actually be causing more harm than good, causing more stomach upset and gassiness in your baby. Okay, so I can kind of read you exactly, and I'll provide the link to the AEP's responsive feeding article as well, so you can have that in its entirety available to you. So, of course, you want to support your baby in a semi-upright position with their head cradled in the crook of your arm, or however you are most comfortable feeding in that type of position. You never want to lay baby flat, of course, because that can cause choking, and it can also cause increased ear infections, because it can actually, the liquid can actually go into their tubes in their inner ear there and cause ear infections. So you always want to have them propped upright, or a semi-upright position. And like I said, hold the bottle so that the milk is completely covers the nipple to reduce the amount of air they're taking in. Okay, I'm just reading my notes here to make sure I didn't miss any of the main points that I wanted to cover. One thing I did want to mention is sometimes people think that they should follow this pace feeding model, that is the inaccurate pace feeding model for their babies if they are experiencing something like GERD or reflux. And the thing I want to say about that is really just kind of, again, follow your baby's cues. If you notice that they are having a really hard time with managing the flow of the nipple, yes, that might be a good indicator that you need to size down in the nipple. Or perhaps that bottle isn't working well for your little one. Sometimes finding the right bottle can be a little bit of a trial and error process, okay? So it doesn't necessarily mean that you need to follow these very strict and restrictive rules around paced bottle feeding. It just means that you need to try, something a little bit more, a little different as far as the feeding, the way you're feeding. You still don't want to hold it parallel, because that's going to cause worse problems with drinking in that air, on top of having some reflux issues, okay? So really just follow your baby's cues. If you need to allow them to take little breaks because they are choking on the amount of milk, that's different than trying to, purposefully time how often you're taking the bottle out of their mouth. I mean, some of these methods that I've seen are just really, really restrictive, and following it to a T, instead of allowing that flexibility of your child to learn their hunger cues and to follow those and to be able to manage their own feeds in a way that's ensuring they are actually satisfied and getting the amount of milk that they need. Okay, so yeah, if your baby has these certain things that you're working through, be sure to loop in your medical provider on that as well, because they might have other recommendations for you and different treatment plans. And you can burp your baby a few times during the feed too, and that can allow a little bit of a break. But you don't need to be stopping every minute or two to burp the baby. That's going to get them very frustrated, and they may end up getting just too tired of having to, keep going back on and off like that. So my recommendation is to follow responsive feeding. You can start with age appropriate nipple size. So if your baby is newborn, you can start with the newborn nipple and just kind of watch your baby's cues. If they seem like they are getting too frustrated with the flow, then you can go ahead and size up. Okay, so just start there. And something I want to mention too is some moms have really strong letdowns, right? So in those cases, baby might get extra frustrated at the bottle if you have too slow of a nipple on your bottle, because they are used to having a faster flow, right? So that can be something too that can crop up if you're trying to size down too much and be too restrictive on the flow for baby. They're going to get super frustrated. They're going to work really hard and tire easily at the bottle and end up falling asleep, but maybe they're still hungry, but they were too tired. They were too tuckered out trying to draw out that milk. Okay, so that can happen as well. All right, everybody, I don't think I have anybody join me live. Let me just double check my comments here. I don't see any that came up. I'm gonna hit the refresh just in case. It's not showing me anything. So if you guys have any questions about this, please feel free to reach out and let me know. I will be posting those links in the comments excuse me, I'm going to post the picture. It is only for informational purposes only, so you can kind of get a visual and what to look out for if you're seeing these in your groups, and to know that when you spot that, it is inaccurate and it is woo, okay? So I don't want you to be tricked by these cute little images that sometimes people have put together. I want you to remember that paced bottle feeding, unless it's under the supervision of a medical provider for certain medical conditions for your infant, is really unnecessary. What you can do instead is practice the responsive feeding methods, which will really set your little one up for success from the very beginning. Okay, so I will drop those below, as well as the link to the AAP's article on that. And I did want to mention as well, if you are looking for some more support in your lactation journey or in your postpartum overall, I do offer one-on-one coaching services, and I will post a link to my calendar below here where you can schedule a totally free 30-minute strategy session with me, where we can talk about where you are in your lactation journey, in your perinatal time frame. So whether you're pregnant and preparing for postpartum, or you're already postpartum, and we can talk about the areas that you're struggling in. We can talk about what your goals are, and we can talk about where your nutrition is and your self-care currently. Okay, those are all super, super important things that I cover in my one-on-one coaching service package. And it is tailored 100% to your specific needs and where you are. I meet every client where they are in their own personal journey, and I provide so many tools and resources to help you ensure that you can meet the goals that you set for yourself as far as your healing, your nutrition, and work with you through your lactation journey. Even when things might not turn out the way you want, I will be right there by your side to help support you through those obstacles and to help you get to a place where you feel really good about where you are. And I'd love to be able to chat with you about that and see if those services would help fill in those gaps that we identify on the call, and how we can work together to really help you feel empowered through your postpartum journey and to feel prepared for it as well if you're in pregnancy. So feel free to schedule a call with me. I will drop my calendar link below. And if you have any other questions, you can always just DM me and ask me those, and I'd be happy to answer those as well. So I hope you all have a great Monday. And really quick, I want to show you something kind of funny. You guys, look at this water bottle. It's literally bigger than my head. I just ordered this because I need to get better at hydrating. And it is a gallon, which I don't believe I need a full gallon of water every day. But as a breastfeeding mom, there is evidence that has been shown that we need to increase our amount of water that we are intaking to help support our supply. So, which I think the latest research that I saw was somewhere around 104-ish. That was not an estimated, but kind of a rounded number from the research of ounces. So 104 ounces a day, give or take, depending on your personal activity level and all these things, right? But it's definitely way more than I have been drinking. So I really love this water bottle, you guys. I'll let you know how it goes, but it's kind of cool. You can kind of see it has like little motivational things and kind of nice spaced out timing for how much you should be drinking. Like I said, I don't know if I'll need this entire bottle every day, but my goal is to try to at least get those 100 ounces in every day to try to see if that makes a difference for me. So anyway, it's kind of lactation related, so I wanted to show you that, and plus it's just hilarious how oversized it is compared to my head. So hope you all have a great Monday. I will be back here live on Friday for Free Coaching Fridays. So if you guys have anything specific over your own personal postpartum journey, anything you're struggling with, you want advice on, any of those kind of things, that is perfect to bring for Free Coaching Fridays. It's your chance to pick my brain on all of the amazing things we cover in here: postpartum nutrition, self-care, and lactation. All of these things that we cover are free game. Of course, I can't give any medical advice, but I am happy to answer any of those more generalized questions that you might have. And also, if you do not feel comfortable asking those in the group or actually on the call, feel free to DM me and I can bring those up anonymously as well. All right, ladies, I will give you back the rest of your night. I hope you have an awesome rest of your week, and I will see you all in the group.